Hello, I'm Christiansen, President of ACTS Retirement Life Communities. Welcome to another episode of ACTS Vision, Our Journey Forward, filmed on September 1st, 2021. Since our last episode, there continues to be many significant developments in our nation's ongoing battle with the coronavirus pandemic. As we've promised from the very start of the pandemic, more than 18 months ago, we continue with our efforts to keep you updated and well-informed on the many aspects surrounding COVID-19 and its impact on the ACTS family. As you have likely heard, the Pfizer COVID-19 vaccine has been fully approved by the United States Food and Drug Administration for individuals 16 years of age and older. The vaccine also continues to be available under emergency use authorization, including for individuals 12 through 15 years of age, and for the administration of a third dose for certain immunocompromised individuals. In addition, vaccines offered by Moderna and Johnson & Johnson are also currently available under emergency use authorization for people 18 or older. The FDA's approval of the Pfizer vaccine is a positive development that we hope will lead to more people getting vaccinated throughout our country and help to bring the pandemic to an end. As we shared in our last episode, the Biden administration has announced its intent to make employee vaccination mandatory in all nursing homes as a condition for those facilities to continue to receive funding, such as Medicare reimbursements. In addition, some states are now mandating all healthcare workers, including those in long-term care settings, to be fully vaccinated or face strict testing requirements, a trend that will likely accelerate in the days and weeks ahead. By now, you are likely aware from our previous communications that vaccination against COVID-19 is now a condition of employment at ACTS. Our decision to mandate vaccination was made for the safety of all those who live in, work at, and visit our campuses, and has been largely applauded by both residents and employees, as well as prospective residents and family members. As a reminder, all employees working in Oak Ridge Terrace or Willowbrook Court or provide direct care to residents must be fully vaccinated against COVID-19 by October 1, 2021. All other employees must be fully vaccinated against COVID-19 by November 1, 2021, unless approved for a religious or medical exemption. In this episode, I will be joined by two guests, Jonathan Grant, Senior Vice President of Community Operations, and Holly Schade, Senior Vice President of Health and Home Services. Jonathan will provide an update on cases and transmission rates at our ACTS communities and the surrounding areas, as well as the recommended or in some cases required safety protocols. Holly will discuss the recent announcement that COVID-19 booster shots may be offered to all eligible Americans beginning in the fall, subject to the expected approval from the FDA and CDC, and how this differs from the third dose approved for individuals that are immunocompromised. At this time, I am pleased to welcome Jonathan Grant.
Thank you, Karen. As we are all aware, the United States continues to experience a surge of COVID-19 cases fueled by the highly transmissible Delta variant. Across the ACTS organization, we have a total of 77 active cases as of today, an increase of 39 cases since our last episode. The number of cases is almost evenly split between residents and employees, are specific to exposures outside of ACTS, and do include breakthrough cases. Fortunately, those that are vaccinated and test positive typically have mild or no symptoms. However, it remains very important for all of us to take precautions at all times, and especially when leaving the community and having visitors. The majority of our cases continue to occur in our Southeast region, where the vaccination rate amongst our employee population is currently the lowest. Additionally, the transmission and hospitalization rates across the counties we operate in remain at high levels. However, we have also experienced some recent new cases in other regions. According to the CDC, the majority of our nation's population live in an area with high or substantial COVID transmission rates. The CDC has recommended indoor mask wearing for both unvaccinated and vaccinated individuals to help curb the spread of the virus in these areas. This includes all of the counties where ACTS communities are located. In addition, certain localities are now mandating mask wearing in public indoor spaces. This recently occurred in Matthews, North Carolina, and others may be forthcoming. We will continue to monitor developments and mandates from federal and local governments and remain prepared to adjust our campus protocols as needed quickly and safely. We have asked each executive director to prepare a safety checklist for certain large-scale events so that we can continue our pre-pandemic activities while also providing for the health and safety of attendees. Additional protocols we are implementing in Willowbrook Court and Oakbridge Terrace are related to admissions or readmission from the hospital. Unfortunately, there have been a number of cases across the ACTS communities of fully vaccinated residents residing in Willowbrook Court or Oakbridge Terrace testing positive immediately following a hospital stay. We are extremely committed to doing everything possible to prevent COVID outbreaks. And as such, we have specific protocols in place that include testing and certain isolation protocols to safely care for these residents returning from the hospital. Please know that in these circumstances, visitation will remain available as a compassionate care visit. With the rise in cases and high transmission rates across the country, we continue to urge all residents and employees to be extremely cautious, especially when traveling off campus, as the evidence is clear that COVID-19 is still very active throughout the country and in our local areas. Please follow the guidance from the CDC and wear a mask when you are in indoor public spaces. Wash your hands and maintain appropriate distancing. The good news is vaccination rates continue to increase at a stronger pace over the past month, particularly in areas hardest hit with the Delta variant. We certainly hope that even more will get vaccinated with the recent approval of the Pfizer vaccine. Here at ACTS, more than 9,200 residents and 5,200 staff members are now fully vaccinated, representing 96% and 76% respectively of those eligible for vaccination. We are also greatly encouraged that all of our 26 communities have achieved our targets for resident herd immunity, and at this time, 21 communities have reached both resident and employee herd immunity. Indian River Estates is very close to being the 22nd community with an employee vaccination rate approaching 70%. Thank you all for your ongoing cooperation during these challenging times. We have now come so far, and I know that together, through the collective actions and efforts of the entire ACTS family, we will defeat COVID-19.
Thank you, Jonathan. And now it is my pleasure to welcome Holly Schade.
Thank you, Karen. Many have asked the difference between the third dose approved for individuals that are immunocompromised and the expected approval of a booster dose for all other age-eligible individuals. The CDC has recommended a third dose of the Pfizer or a Moderna vaccine for those individuals who are moderately to severely immunocompromised. As immunocompromised individuals, which includes those people who have the conditions listed on the screen, may not build enough of the protective response after the first 2 doses of the vaccine, and a third dose can provide additional protection. Please contact the Wellness Office for assistance in determining your eligibility and scheduling the administration of the third dose. This differs from the expected booster shots, as a booster shot is not needed because people haven't built strong enough immunity from the first 2 doses, but rather it is due to the fact that immunity might wane over time. Federal health officials have indicated that the COVID-19 vaccines are working well at providing more than 90% protection against severe disease, hospitalization, and death. However, the need for a third booster is expected due to a triple effect of a naturally waning immunity, a fast-moving new Delta variant, and a U.S. population that's unfortunately been slow to get vaccinated. While antibodies can be considered our first line of defense, we know that they can wane over time, and there's growing evidence that the dominant Delta variant can invade this type of protection. This is why a second line of defense is important, which is the body's cellular response to vaccinations. Immune cells, called T cells, can recognize these hijacked cells and work together to kill them before they produce more virus. B cells also set up a longer-lasting production of antibodies and can help recognize and neutralize viruses as well. These longer-term cellular immune responses are what keeps people protected from severe symptoms that may result in hospitalization or death. A booster dose of the Pfizer and Moderna vaccine has not yet been approved, even under emergency use authorization. But emergency use authorization is expected by mid-September. People who receive the J&J vaccine will likely also need a booster dose, and more data is expected in the next few weeks. When federal health officials give the approval for the Pfizer and the Moderna booster shots, which is currently expected by September the 20th, rest assured that ACTS will be well prepared. We are currently working with our pharmacy partner, CVS, in pre-planning clinic dates and in identifying the number of individuals to be vaccinated from our prior vaccine clinics. Please remember that no vaccinated person would be at risk of a breakthrough infection if the coronavirus wasn't still circulating. That's why the push to get more Americans fully vaccinated is still the highest priority and our priority here at ACTS. We all need to do our part in eradicating this virus once and for all. So do not hesitate. Please get vaccinated, and please get your third booster when it is available. Thank you.
Thank you, Holly. Thank you for watching this episode of ACTS Vision, Our Journey Forward. While we certainly were hopeful our journey would have moved forward more quickly, please know that our highest priority remains the safety of our residents, staff, and visitors. We will work very hard to provide booster shots expeditiously once authorized by the FDA and CDC. Until then, please understand that breakthrough cases are possible and are occurring. So please continue with the preventions and practices that are extremely effective, including mask wearing, hand washing, and proper social distancing. While certainly not ideal, please also consider wearing a mask when visiting with unvaccinated family and friends. Thank you, and may God continue to bless you, your families, and the entire ACTS organization.